Hi, I'm Kristine Weber of Subtle Yoga. I'm making this video right now as a complement to the presentation that I'm going to be giving at the IAYT conference on June 15th, 2017. IAYT is the International Association of Yoga Therapists, and the conference is being held in Newport Beach. So I'm presenting as one of the community interest or common interest community presentations on Thursday the 15th. And those presentations are relatively short. They're less than 20 minutes. So I wanted to make sure that I put this video together for people who aren't going to the conference and also for people who might be interested in the topic. So the topic of my presentation is about yoga therapy and population health. And if you've never heard the term population health before, you'll understand what it means at the end of this presentation, and I hope it's going to be helpful for you in whatever work you're doing with yoga or other mind-body therapies. So I'm a yoga teacher and a yoga therapist, and I've been practicing since 1989, and I've been teaching yoga since 1995. I began training yoga teachers in 2003. In the beginning of my career, from 1995 to 2001, I spent more than 5 years working as a yoga therapist. I was also doing acupressure and massage therapy and other recreational therapies at a nursing home, assisted living, and hospice facility in Pennsylvania. I've also spent time working in a hospital here in Asheville as part of their employee wellness program, and I've also spent almost 2 years working in a drug and alcohol treatment center. For the most part now, what I do is train yoga professionals. I also train mental health professionals to use yoga in their clinical practices at the Mountain Area Health Education Center, which is here in Asheville. And other AHECs around North Carolina, which are loosely affiliated with the North Carolina university system. And so people come to my programs and they get CEU credit for learning about yoga therapy and other mind-body therapies, or I should say integrated yoga therapy, because I don't simply teach asanas. I also teach meditation, mindfulness skills, pranayama, or breathing practices, and as well as ethical engagement. I also do quite a bit of writing. You can check out my blog at subtleyoga.com. I've written several articles for different publications, and my husband is a therapist, and together we do groups for people with anxiety and depression here in Asheville. So I just wanted to give you a little background about what I'm doing. One of my big interests is the integration of yoga and yoga therapy into the healthcare system. So I have three main objectives today for this presentation. One is to give you an overview of the healthcare crisis, just briefly, and the response that many individuals and organizations have made to that crisis over the years. And sort of what's going on out there in terms of healthcare policy and health innovation, how integrative health practices like yoga therapy are being woven into the system to some extent, or at least how they've been conceptualized, and then how, how to help you understand how you can use your knowledge and your skills in yoga and yoga therapy to be part of the solution to the healthcare crisis that we're facing. So I want to start with this. I want to talk about my vision for what healthcare could look like. I have this vision that there could be meditation and mindfulness practices, even places to practice meditation, mindful movement on the floor of every hospital. There could be a room designated for that. I have this vision that contemplative and mindful movement practices could be taught from very early childhood and interwoven into all levels of education, so that children are learning about the inner universe as much as they learn about the external universe. I have this vision that employers really value the physical, the mental, and the spiritual health of their employees. and that they offer opportunities to foster mind-body practices in the workplace, and that they are fully aware of the research that's out there that is telling them that mind-body practices are going to be useful to their bottom line. I also have a vision about healthcare education, that nurses and doctors and all of the allied health professionals are trained in mind-body practices, that their training incorporates the whole spectrum of health, the mental, the physical, the spiritual spectrums of health. And my other vision is that yoga therapists and well-trained yoga teachers can work collaboratively with healthcare providers across the spectrum of healthcare services, which means treatment, but also prevention. It means aftercare services after treatment, and it also means health promotion throughout all those spheres of care. And I also see people across society engaging in mind-body practices that can help them be more efficient in whatever they do, that helps them to be healthier, and that helps them to be able to better resolve conflict. So, you know, I think it's a expansive vision, but I don't think I'm alone. Perhaps you're listening to this, you've listened this far, maybe your vision is something similar, and they may say that we're dreamers, but really not the only ones. What we hold is a very important piece of this puzzle of healthcare, and there are many dreamers out there. There are many other people that are working towards a similar vision. So to have a big vision is the place to start, and then you can start figuring out how to manifest that vision, how to make it happen. So the reality is that while there are isolated places where this vision is manifesting, isolated institutions or communities, the reality is that we are mired in a tsunami of crisis when it comes to healthcare right now. It is an overwhelming crisis. We, as a country, the United States spends, or in 2016, we spent $3.2 trillion on healthcare, and 86% of that amount goes to chronic, likely preventable diseases. So largely preventable diseases, I'll say. So the reality is that we are living at a time when people are very unhealthy. We have many health challenges right now: heart disease, cancers, obesity, and certainly mental health challenges as well. There is a large body of research that is beginning to reveal the benefits of lifestyle therapies, which includes things like mindfulness, meditation, breathing practices, and yoga postures, which could be fully integrated into community initiatives. And it could be recognized and supported by health professionals. And I think as an essential part of quality healthcare, and I think this is the direction that we have an opportunity to move in. According to David Katz, who is the president of the American College of Lifestyle Medicine, lifestyle as medicine has the potential to prevent up to 80% of chronic diseases. In addition, it's potentially inexpensive and even cost-saving, free of all but good side effects, safe and appropriate for children and octogenarians alike. It is quite simply the best medicine we've got. So these practices, these lifestyle medicine practices, could be cultivated within the medical community itself and integrated into medical training. You know, if you have ever met anybody in med school, you, I'm sure, understand, or in any higher academic pursuit in healthcare, I'm sure you're aware of how grueling that education is. And yet, to incorporate contemplative pedagogies into the training of medical professionals is a wonderful first step in terms of getting the medical professionals to buy in to the relevance and importance of these practices, and then to share that with their future patients and clients. So, you know, these practices should be cultivated within the medical community, and not simply seen as some sort, or conceptualized as some sort of add-on. The way that I see mindfulness, meditation, yoga practices being delivered till now is more sort of like, here's some little extra thing we add on. I would suggest that actually these should be central to the way that we think about healthcare, the way that we think about delivering healthcare. There are organizations, for example, like the National Center for Interprofessional Practice and Education and the Interprofessional Education Collaborative, which are aspiring to improve healthcare education through really these kinds of more holistic systems approaches. The work has the potential to dismantle some of the silos of thinking that we have been stuck in as a culture around policy and practice, and really create more viable solutions to the healthcare crisis. There are organizations like, for example, the Robert Wood Johnson Foundation that, and many people that are really on the cutting edge of advising policymakers who are deeply concerned about the healthcare crisis that we're facing, and they're working towards this whole systems change. So the Robert Wood Johnson Foundation has created an initiative they call a culture of health. And so their idea is, let's start to shift the culture. Let's really find ways that we can we can create a culture of health out there so that people are actually very conscientiously moving towards improving health outcomes. And there's 10 points that I'm going to read you from their culture of health. They say good health flourishes across the geographic, demographic, and social sectors. The second one is attaining the best health possible is valued by our entire society. Number 3, individuals and families have the means and the opportunity to make choices. Number 4, business, government, individuals, and organizations work together to build healthy communities. Number 5, no one is excluded. Number 6, everyone has access to affordable quality health care. 7, healthcare is efficient and equitable. 8, the economy is less burdened by excessive and unwarranted healthcare spending. 9, keeping everyone as healthy as possible guides public and private decision making. And 10, Americans understand that we are all in this together, which sounds to me a lot like yoga. You know, that we are much more connected than we can even imagine. Yeah. So that's something that's happening from a big foundation that is focused on improving health. I also want to talk about the Public Health Institute, which has proposed a framework called Health in All Policies. The idea here is that key players in society work together towards improving the health of all people by incorporating health considerations into decision making across the sectors and policy areas. So we're thinking about things like, do we build sidewalks in our community? You know, where do we invest money in our infrastructure? How do we invest money in all of the policies that we think about? Education across the spectrum of services. The Institute for the Public Health Institute did this as a response to these complex and interwoven problems of poverty, economic disparity, health inequity, chronic illness, rising costs, the fact that the baby boomers are aging, and environmental problems, and also government efficiency. You know, policy wonks actually call these kind of problems like healthcare wicked problems or social messes. Like, those are technical terms that they use for them. And what it speaks to is that these are extremely challenging problems to solve that have tentacles in so many different aspects of our society. But that doesn't mean we shouldn't take them on. It just means we have to understand that there is not a silver bullet. There are going to be many aspects to shifting. So the next thing I want to talk about is something called health innovation, which is an important trend that I think yoga therapists and yoga teachers could keep their eye on. Policymakers are looking for new innovative strategies, and also what's called transdisciplinary thinking. So that it's just what I'm talking about, the systems issue. So it's like taking people who are experts in different fields and letting them work together to come up with viable solutions. So you want to look at yoga therapists as having a piece of that solution. There's actually an annual Global Health and Innovation Conference. There's several health innovation conferences. There's an annual Global Health and Innovation Conference, and what strikes me is that innovation is often considered things like, oh, we've got this new technology, or we have this new gadget, or we have this new drug. And innovation could also be, what do we have that's really simple and human and life affirming, like yoga practices, that and cost effective and empowering, and it can be provided in groups rather than one-on-one. So we have so many positive and really the characteristics of yoga therapy are exactly what health innovators are looking for. To some extent, I think we really can have a great argument for that. There are some really powerful forces out there for positive change amidst this whole tsunami crisis that we're dealing with. But let's be frank, when you analyze why healthcare is so much more expensive in the US, in the United States, we spend 2.5 times as much as any other country on our healthcare, and our outcomes look like a developing country. Our outcomes are abysmal. So what is it? You can't leave out the fact that we have essentially surrendered our healthcare in this culture to the free market, where profit reigns and human values are really lost. So the kleshas from Patanjali's Yoga Sutras, right? Ignorance, egoism, attachment, aversion, clinging to life. The kleshas are in, they are rearing their ugly head in healthcare, and they have free reign to express themselves. The system as it is, it really rewards expensive, high-risk, invasive practices. It overlooks prevention completely. It kind of overlooks health promotion. Most of that, which is, by the way, it's a $600 billion industry. Most health promotion happens in the private sector, which means it's only available to people who can afford it, right? You've seen that, and when you go to a yoga studio, it's obvious. So the most profitable, rather than the most appropriate therapies, the most profitable therapies are the ones that get researched and implemented. And this is a deep systems problem that doesn't help us to ignore or say that's just the way that it is. Rather, there's ways that this system's problem can be overturned. And many people are looking at this problem. For example, there's a physician journalist named Elizabeth Rosenthal who's really seen the dysfunction in the system firsthand, and she wrote a book called An American Sickness: How Healthcare Became Big Business and How You Can Take It Back. And she wrote that the U.S. healthcare system really pivots on ideas like a lifetime of treatment is preferable to a cure because you make more money that way, and prices will rise to whatever the market can bear because we've surrendered our healthcare to the free market. So we really need to shift from what has been called a volume-based care, like do lots of procedures and treatments, get lots of reimbursement for it, to values-based care, where we're putting ethics at the forefront of everything we do. This is not some kind of utopian ideal from a hippie yoga teacher from Asheville like myself. It's really an idea that was birthed by Don Berwick, who is the former president and CEO of the Institute for Healthcare Improvement. This is the guy that created what's called the Triple Aim. It's a framework for healthcare improvement. If you're not familiar with it, I have an article about the Triple Aim that is on the IAYT website. It was adopted into the Affordable Care Act. And the Triple Aim is 3 things. It's improving patient experience of care, having that sense of value rather than volume. It's about reducing cost, because that's important. And it's also about treating populations as opposed to just individuals. So looking at clinical and geographic populations, that means If I'm a yoga therapist, I can be working with the population of diabetes, for example, in my geographic area. So I'm not just focusing on individual health, but I'm looking at that whole population. Now, of course, you know, it depends on how you can get into the system. We're going to get to that later. And I do think in 20 years, we're going to be very well integrated into the system. But right now, we've got to be on the forefront of making that happen. Anyway, to go back to Don Berwick, what he has done, he's actually called for a new moral era in healthcare. That's his thing. He argues that the healthcare industry must change its focus from profit maximization to improving quality of care, and that healthcare must be practiced with transparency and a lack of greed. Without a new moral ethos, there will be no winners, he said. So I want to read you a little bit of what Don Berwick has said and written. This is one of the quotes from when he was talking about this idea of new moral era in healthcare. He says, Justice is the manifestation of love in our public policies and in our conduct. And injustice contradicts excellence. So he's arguing that social justice essentially is what is needed to make healthcare more efficient. I mean, this guy sounds like a yogi when I hear him talk. I want you to read a few more quotes from him. He says, the answers are pretty clear that among the great disruptors of health are injustice, inequity, racism, and a failure to regard healthcare as a human right. These, to me, are moral issues. The commitment to a fair and just society, one in which equality is embraced, is one in which responsibility for each other is part of the fabric. To me, this sounds right. It matches my ethical frame. It also sounds smart because what you're interested in is people who can live lives at the highest level of function and be productive in society and enjoy their lives. The relationship between poverty, injustice, racism, and inequity on one hand and health status, function, and longevity on the other hand are very well described. I think health professionals need to be advocates for social justice. Hospitals need to inspect their processes of care and to see that they are sensitive to issues of social determinants of health and social support that people need in order to stay out of the hospital. That needs to be woven into the fabric of hospital care. To me, this is really an exciting thing coming from a top policymaker in the United States, and it gives me hope that there is the possibility for change in the system that we are currently, struggling with. So, what do we need to have excellent health care is the question on my mind and on many people's minds. And I think what we need is a shift. We need to shift. We need to have this cultural shift in all social sectors, multiple levels of government, philanthropic organizations, insurance companies, hospitals. The shift has to be towards justice or a shift towards love, what Don Berwick would call love. I don't know about you, but that's ultimately why I came to yoga and why I love this practice and this work so much in this community so much. The question is, how do you shift out of greed? The shift, I think, can be catalyzed by a system which promotes and implements mindfulness, contemplative practices, mind-body practices, mindful movement practices, and a system that unambiguously promotes human values over profits. So yoga practice was designed to make you your best self and to allow these very human qualities to emerge. And it really helps to bring to the surface, or I should say yoga helps to bring to the surface these underlying insecurities and the sabotaging attitudes that produce dysfunctional behaviors and dysfunctional thoughts and attitudes. So, why not have some kind of mind-body practices incorporated into the shift? That we start to understand that we want to move towards more human values, and in moving towards those more human values, we have to be the change that we want to see. It has to happen from within. So, this is why I think it needs to be incorporated not just in the mindfulness practices, mind-body practices, not just in the, not just for the consumers, but also for the practitioners and in their right into their education. So as I mentioned before, Don Berwick was the guy who spearheaded the Institute for Healthcare Improvement's development of a framework called the Triple Aim that was adopted into the Affordable Care Act. This is where population health is slightly different than public health. It's looking at whole populations, as I mentioned, or whole groups of people improving their health together. And I think it's a very, very much a yogic idea as well. So to go back to that idea of population health that I started the presentation with, how can we be helping people move together and supporting each other in the transformation? You know, the system has to transform. People need to transform their individual ways of dealing with their health, and we also need to support each other in that transformation. There is a myth in American culture that we are all individually responsible for our own health. And in fact, the Robert Wood Johnson Foundation did a study about this. And what it revealed is that up to 70% of the drivers of health are actually external to the individual. There are things like, do you have access, the social determinants of health, do you have access to health care? Do you have access to clean water and good food? Do you have access to education? Who is your social networks? Who do you hang out with and how healthy are they? So up to 70% is external. And what I really see yoga doing is helping to drive the locus of control internal. So it takes our responsibility and it empowers us to be healthier ourselves and to not be so reliant on those external factors. So how does yoga therapy fit into this triple aim idea of population health, improving patient experience of care, and reducing costs? Well, I really think that yoga therapy should start with prenatal and postnatal care and then be available to people throughout their lifespan all the way into their final years. And that, of course, the way that the service is delivered is going to change, and what the yoga therapy looks like is going to change. But let's stop talking about prenatal yoga like it's some kind of a, thing for bored suburban white housewives to do because they have some disposable income. And start, not that they don't need that too, of course they do, but we should start thinking about prenatal yoga as an important part of public and population health, that we know there's good research that shows that the stress levels of the mother are going to influence the stress systems in the child. And the stress systems in the child, when they are not resilient, then result in really negative health outcomes 30, 40, 50 years down the line. So there's a strong correlation between that early childhood, those early childhood stressors, including the health of the mother, and then chronic illnesses later. And if 86% of our health dollars are going to chronic illnesses, of course we want to start at the beginning with these preventative services. So pre and postnatal yoga should be seen as essential practices for helping the mother to self-regulate and actually influencing the development of the system in the child, and turning off those epigenetic markers that lend themselves to these chronic illnesses later in life for the child. And I think that these yoga therapy services should be provided across the spectrum of healthcare services. I mentioned these earlier. There's essentially four. There's treatment, which is where most of our healthcare dollars go, unfortunately, the $3.2 trillion. There's prevention. It's kind of obvious. An ounce of prevention is worth a pound of cure, and there's lots of research on that. And the Affordable Care Act put $10 million into prevention services over a period of 10 years, which is nothing, 10 billion, which is nothing compared to the 3.2 trillion. And every year Congress takes half of that money away to use it for something, to stem the flow of the tsunami that we're facing. So the prevention services need to be much more better utilized, and yoga therapy is that's where yoga really shines, is in the prevention. And that, so there's, you got treatment, you got prevention, then you also have aftercare, which is thought of, or recovery, so which is thought of as what happens with people after they recover from whatever incident, whatever treatment that they were dealing with. And then the fourth area is health promotion, and the Institute of Medicine says that health promotion should happen across the other four domains, right? It makes sense. The health promotion should always be incorporated into everything that we do in terms of the health system. Last year, a study came out from the Henry Benson Institute. You might know Herbert Benson is the founder of the relaxation response. He did that original research in the 70s. I want to read you this quote about relaxation practices. That was part of the study. They said, the authors of the study said, the data suggests that mind-body interventions should perhaps be instituted as a form of preventative care, similar to vaccinations or driver education. Such interventions are likely to be useful in population management and supported self-care, have negligible risk and costs, and may help reduce the demand curve in healthcare. Yep, there it is. So how do we integrate it? I think, there's many people working on this right now there's a few of us in the yoga therapy world, many people in the broader healthcare world. And what, to me, as yoga therapists, I think we have a unique potential to help shift this system. I would suggest that there's essentially 4 key steps that you can take. I think there's all these other things need to happen. Whichever, if anything sparked your interest, I strongly suggest you get out there and present at conferences and talk about this stuff. But I think there's 4 key steps we can take, like sort of in our community or our region. And I would start with approaching the key players. For me, when I started doing health professional education, the way I kept going to the area health education center, trying to find the right person to talk to. I talked to several people. It was when I found the woman, I noticed the yoga mat in her office, and I wanted to talk to her. That's when I got the door open. So you got to find the people who've already bought in a little bit. There's 36 million people practicing. Lots of them are healthcare professionals. Find those people, because they probably frame yoga more as a fitness or a recreation strategy and probably don't think about it. It's a silos of thinking thing. They probably don't think about it in their sphere, but they could. And you can present them with lots of the great data. So, so that's the one. Approach key players. I'm going to tell you about that data in a minute. And then the second one is creating a framework for integration of yoga. So this is where we have to start piloting programs, whether it's a program that you're doing for a health department, a stress management class, or you're working with at-risk youth, or you're working with women with eating disorders at a private, hopefully some kind of associated with some kind of institution. We have to start having these little pilot studies that say, hey, something's happening here. And then how can we collaborate with researchers and replicate the programs that are successful? How do we do this sort of in a grassroots way? I think the third step is promoting that culture of health in whatever organization you're involved in. And the fourth step, I would say, is promoting clinician self-care. And I mentioned this earlier, but the piece that I want to say here is that the triple aim, after it came out, which was in 2008, was critiqued. And one of the things, of course it's critiqued, right? And one of the things that came out was that there's not enough focus on clinician self-care, and that should be the fourth part of the triple aim. So the quadruple aim, I guess they should be calling it, because the clinicians themselves are under a tremendous amount of stress and pressure. So how do we help the clinicians? How do we promote clinician self-care? I've got some students out in Washington State who are doing an amazing program called Live Well Northwest, where they're working with clinicians with mindfulness and mind-body practices and yoga to help shift. So that's basically all I want to say at the end here. I know that was like 35 minutes and it was longer. I hope you watched the whole thing. Like, I know people have the attention span of a goldfish, they say. these days. So if you got through the first few minutes, that's great. If you got through the end of it, if you made it with me this far, I really appreciate you sticking around. I would invite you to go to my website, settleyoga.com, go to my blog. There is a blog on there that you need a password for. You can just email me to get the password. Let me find the name of that blog. It's called CIC number 6. And it's I'm sorry, I can't find it, but anyway, it's called CIC number 6. And it is a recap of all of the points I just mentioned. It's not really, it's just an outline of all the points I just mentioned, and it gives you a lot of good resources, because I'd love you to take these resources and go out into your communities, do what you can to make a change, and we'll watch this thing start to change together. So I hope this has been helpful for you. Thank you for spending time with me. Namaste.